To log on to the meter, press the power button quickly and wait on the meter to power up and do a self-check. At the prompt, please pull out the cuvette holder, open the cuvette holder, and the instrument does a self-test. You are now asked to enter your operator ID. Your operator ID is the last 4 numbers on your Rotunda ID badge. Use the keypad function to enter these 4 numbers. Once you are logged onto the meter, your name will appear in the top left corner and the patient test icon will become available. QC must be run on the meter every day at 2 levels. Level 1 by 8 AM in the morning and level 2 by 8 PM in the evening. If QC has not been run on the meter, you will be locked out from doing a patient test and the patient test icon will not be visible. To release the meter for processing patient tests, you must run the QC. Which QC you have to run will be denoted at the top left of the screen. It will tell you to run QC level 1 or QC level 2 or both levels as the case may be. To process the QC, take the appropriate bottle. In this case, I'm running level 1. Give the bottle a good mix. And always remove the first drop of QC onto a glove or a piece of tissue. We always sample from the second drop. Press the QC function. In this case, it's level 1. Please fill and insert a cuvette. Take your cuvettes. You avoid touching the tip of the cuvette, always handling it from the bottom. Present it at a 45-degree angle to the drop of QC material. Make sure the cuvette is full and free of air bubbles. And wipe the surface of the cuvette on a piece of tissue, just as though you were spreading butter with a knife. Place the cuvette into the cuvette holder and close the cuvette holder. It now asks you to enter the cuvette batch. So we take our cuvettes and we're going to scan the barcode on the cuvettes by selecting the barcode icon and keeping our finger on it. Now you'll be asked to enter the control lot. So in this case, I've used level 1 and I'm going to scan the barcode on the box of level 1. Again, keep your finger on the barcode icon and scan. My QC has passed. And select OK. You are now asked to open the cuvette holder and you can discard the cuvette appropriately. If QC level 2 had to be run, you would then repeat the process, just selecting QC level 2. To process a patient test on the hemoglobin meter, you need to select the cuvette icon on the left-hand side. This is the patient test icon. You will now be asked to enter the cuvette batch, so we're going to scan the barcode on the bottle of cuvettes by holding the barcode icon and scanning. You will now be asked to enter the patient ID. We must type in the patient ID and not scan in the patient ID barcode. To type in the patient ID, select the keypad function and type in the patient hospital number and press OK. Once you have entered the correct patient hospital number, press OK. You will now be asked to confirm the batch number of the cuvettes and the patient ID. If these are correct, press OK. You are now asked to fill and insert a cuvette. Before sampling, the puncture site, so the patient finger or the baby heel, should be cleaned well with sterile water and dried thoroughly. After you lance the puncture site, remove the first 2 to 3 drops of blood with a tissue. Sample from the third drop by holding the cuvette at a 45-degree angle and making sure that there's no air bubbles and that the cuvette is completely full. Once you're happy that the cuvette is full and free of air bubbles, clean the surface of the cuvette by wiping it on a piece of tissue, making sure you don't draw any blood out of the cuvette. Now insert the cuvette into the cuvette holder and close the door. After a few seconds, the result will appear on the screen. You can press OK and discard the cuvette appropriately. It's important to note that the devices are not interfaced to the electronic chart, so you must transcribe the result into the electronic chart as soon as possible. If you are concerned about the point of care results or you're not reassured by it, you must send a FBC to the lab for confirmation. Similarly, if you get a result that would require clinical intervention such as a transfusion, an FBC must always be sent to the haematology lab to confirm the haemoglobin result before any intervention is taken. Haemoglobins of less than 80 should also be sent to the haematology laboratory for confirmation, unless the patient has had a previously low haemoglobin confirmed by the lab. To log out of the device after use, press the icon on the bottom right of the screen. It resembles a door. You are now logged out. When the device is not in use, it should be left powered on with the cuvette holder open and docked on your docking station. This allows information to transfer to and from the laboratory software. If you get an E01 or E02 low intensity error, it means that the internal parts of the device need to be cleaned. To do this, power off the device, gently remove the cuvette holder, take a HemaQ cleaner. If you've none on the ward, these are available from the haematology lab. Insert into the device and clean the optics inside. You would then leave the meter dry for a few minutes before you attempt to use it again. Similarly, after you use the meter to test a patient sample, you should follow up by cleaning the outer surface of the meter with a Clinell wipe or similar antibacterial wipe.